postgraduate and PhD nursing students. Thank you, ma'am, for agreeing to chair this session. I think most of the other chairpersons are not here. I would also like to call the rapporteurs for the session, Mrs. Nishigiri and Mrs. Kripal Kaur Sofi from Trauma Center AIIMS.
Good afternoon, and for the first speaker at the last session is Dr. Deepak Agarwal. Yes, please.
Sorry, there is a change. I think we have Miss Preeti Rajesh in place of Dr. Deepak.
Yeah, she will be representing the nursing informatics system.
Yes, she is a nurse information specialist at this institute.
Thank you, ma'am, for the brief introduction. A very good morning to all of the delegates present here. So I would be dealing with nurse informatics system on behalf of Dr. Deepak Agarwal and myself, Preeti Rajesh, presently working as nurse informatics in AIIMS. So, as the name indicates, nurse informatics is a specialty that integrates nursing science, computer science, and information science to manage and communicate data, information, knowledge, and wisdom in nursing practice. This is a well-established branch of nursing in foreign countries like UK, US, and Canada, but still at an emerging phase in India. So, who are nurse informatics? We are basically a group of nurses who have been trained in IT briefly, and they bridge the gap between nursing and technology, leading to better patient care and transparency in the healthcare system. So, what was the basic need to have a nurse informatics system in AIIMS? AIIMS being a tertiary center hospital, well established, having various specialties and catering to a huge patient load, but then had just the patient registration online before this informatics was started. So the vision with which the nurse informatics system was started was to have a complete digital hospital, improving patient care and satisfaction, improving transparency and accountability in administration, creating a better working environment for the employees, and improving the quality of training and research. And the main motto was to do it all cost effectively and be a pioneer and a role model for all the new AIIMS setup and other hospitals in India. So, with this vision in mind, the pilot study was started in Trauma Center, that is Jayaprakash Apex Trauma Center, which is a branch of AIIMS, and a group of nurses like around 5 to 9 nurse informatics were started by Dr. Deepak Agarwal under the guidance and support of the then Chief and the present Director, Dr. M.C. Mishra. And within a short span of time, it was a real success, with Trauma Center becoming a unique of its kind, having a call center of its own, and a well-complete appointment system with a QLS OPD, and an emergency department fully digitalized with the display system for both doctors and patients, and a full electronic medical records with online packs integrated into it. So, this being a success, the same thing was replicated in the main hospital and extended to its centers over a period of 8 months, and it was started with around November 2013 with around 7 to 10 NIS, and which was later on extended to around 75 NIS. So the role of nurse informatics is not only limited to nursing, but they have other activities like organizing and conducting various education programs, continuous training of nurses and doctors and other healthcare professionals in the hospital, conducting induction programs for all the new employees joining, providing 24/7 support, bridging the gap between technology and healthcare, channeling the information, coordinating mainly with the IT team to get the necessary customizations done according to the needs. So I'll just rush you through the journey of NIS and AIIMS. Like we started with the admission transfer module, in around November 2013. So we can see the initial scenario where a doctor had to call up different wards to get a vacant bed. But now, as of now, like they can just log into the system, get to know where the beds are vacant. So now it's 100% in all the wards, and it's really transparent. Okay. The online store module was introduced into December 2013, leading to transparency of stock maintenance and utilization. The whole inventory is now online. And the LIS, that is Lab Information System, was integrated with the Hospital Information System in around December 2013. And now we have all the reports of the patient coming online, and it is made accessible through intranet and internet. Electronic death notes, OT lists and duty rosters were made online around January 2014, and now it's 100% compliant. Online PAC system was introduced in Jan 2014, where you could get the X-rays, MRI, CTs of the patient online, like in intranet, and that has greatly affected the decision-making time. It has really reduced it. So you have kiosk machines placed in all wards where you can get to see the X-rays, and the PAC system has been made available. And we have started with the computerized patient record system in March 2014, and as of now, most of the notes, like the discharge notes, the transfer notes, and the operation notes, are 100% in it. In the emergency department, it has been replicated from trauma center. The patient display system is being made available for the doctors and the patients with the basic details. And AIIMS has been made under Wi-Fi coverage since May 2014, and a faculty dashboard giving all the details of their OPD patients, their conferences, the annual leaves, everything. A dashboard for the faculties was made live since May 29, 2014. A dietary module was also introduced in July 2014 with 100% compliance now, where the staff or the nurse enters the diet needed for the patient onto the system, which is reflected in the dietary department, where it's compiled and sent to the respective wards. And another major milestone in the digitalization was the appointment system, which was started from August 2014, where the patients coming into AIIMS can get a future appointment for his particular doctor before leaving the premises. This facility was later on extended to other means, like through web portal, like logging into the AIIMS website. They could take an appointment if they have a unique identity number of this hospital. For those without the identity number of the hospital, they can just log into ORF, where they provide the Aadhaar number and they get an appointment for AIIMS. Another means of taking appointment was the interactive voice response system. By telling the UHID, you'll be able to choose your doctor, and this is the numbers being made available. And a mobile app for Android devices was also introduced, where you just log in with your phone number and the UID, and you can see the lab reports. You can book appointments, and you can even cancel appointments using your Android devices. A call center facility was also made available to book appointments for any department just by phoning up this number. Electronic medical records, medical legal records were started on October 2014, where a printed medical legal record is taken out with a photo of the patient attached, and the final copy, the signed copy, is again being uploaded into the system for future reference. A cash card system was also introduced in November 2014, where it is just like a debit card, where the patient recharges his card and can avail services in the hospital throughout his stay. Electronic birth note was made live from December 2014. So all the birth notes made in this hospital are now online, and you can have it for future reference. The AIIMS website was revamped by the IT team in Jan 2015. And another module, like quality assurance module, which is an academic module to grade the residents in their clinical and academic activities, was introduced in Jan 2015, and in neurosurgery it's now 100% compliant. Exit counters, dedicated counters for appointments of clinics, investigations and OPDs were started around May 20th, 2015. So this is in short a journey which we have went through in 1.5 years of digitalization. And though we had many challenges like resistance to change from a existing system to a new one, the acceptance was only 5 to 10% because of ignorance and inability to use the computers. And initially we had to have duplications like maintain both the manual and the electronic records. But still, it has been a great success. From 0 to around 80%, we are now completely digital. And so the main reason for the success would be continuous administrative support we have got from our administrators, a dedicated and a motivated NIS team for this computerization and implementation process, and a continuous software customization which is provided to us according to the needs. Thank you.
Why not give this software free to all hospitals in India?
Yes, in fact, AIIMS, this software was launched by the Prime Minister as part of the Digital India Week on July 8th. Then the central government authorized the All India Institute to hold an onboarding workshop for 13 central government hospitals. The next step would be to involve the state government hospitals. AIIMS has also requested that this software should be extended to 28 state medical colleges. So that workshop is being proposed very shortly. 19th is our briefing with the ministry. So we'll be taking it forward. It has reduced wait times at AIIMS from 4 to 5 hours to a mere 15 minutes. You can just go out and see the patient reception center, 15 minutes, and you can pay online and you can come straight to the consultation room. It is that kind.
Thank you.
Thank you, Preeti. Now we have next speaker, Mr. Suresh Sangi. He is the Trauma Nurse Coordinator at JPN Apex Trauma Center, AIIMS. He is also a National Coordinator for the ATLS India Program and a Program Director for Advanced Trauma Care for Nurses India Program. He is also an awardee of the AIIMS Union of America Award for the Best Nurse for the year 2014. Mr. Suresh.
Thank you, ma'am, for brief introduction. Good morning, chairperson, dignitaries sitting on the desk, and delegates in the hall. Today, now I am going to present the status of Advanced Trauma Care for Nurses India program. As you all are aware that trauma is one of the leading cause of death in India. It affects mainly younger age group between 20 to 40 years of age. And WHO has projected that the road traffic injuries will be the third leading cause of death in terms of disability adjusted life year by 2020 in India. There is need for standardized training of medical and nursing personnel to manage trauma patients, because managing of trauma patient often is a stressful environment, and trauma causes are different. Severely injured patient must be evacuated as quickly as possible with minimal secondary injuries. So therefore we adopted immediate care provider courses for pre-hospital care. We have adopted PHTLS, that is pre-hospital trauma life support course, and for in-hospital care for doctors we adopted ATLS, advanced trauma life support course for doctors, and advanced trauma care for nurses. We are running in India, and for rural centers we are having rural trauma team development course for PSC primary health centers, so they can safely manage the patient and safely transfer the patient to higher centers. We will see that Advanced Trauma Life Support ATLS India program started in India in April 2009. Presently, if you will see the brief status of ATLS program in India, we are running ATLS course in India in 9 sites, and we have completed 220 courses till date in India in last 6 years of span, and even today also course is going on in Jipmar Pondicherry as well in Symbiosis Pune. And we have trained 3,973 doctors have been trained so far. We will see about ATCN. It is an internationally recognized course for trauma care for nurses. and is the course of Society of Trauma Nurses USA. The ATCN course has been operational for over 20 years and it under the auspices of Society of Trauma Nurses USA, and presently ATCN is currently running in over 20 states across the USA and is also internationally, including Denmark, Saudi Arabia, Italy, Hong Kong, Sweden, Puerto Rico, Spain, UAE, and finally it reached in India in March 2010. Originally, it was standard for nurses who do not manage major trauma on their daily basis, but now it is accepted to be a standard for those who provide care for trauma patients in first hour after injury, and standard for primary health care institutions and for advanced trauma care centers. We will see the goals of ATCN program. The goals of ATCN program is to provide basic knowledge necessary to rapid and accurate assessment of the patient conditions, resuscitation and stabilization of ABCD priority, determination of the patient's need, arrangement for the patient transfers, and assure that optimal care is provided for the patient. ATCN philosophy is to treat the greatest, treat to life first. Lack of definitive diagnosis should never impair the application of an indicated treatment. A detailed history is not the essential prerequisite to begin the evaluation of an actually injured patient. We will see the course structure and organization of ATCN program. It's the course of Society of Trauma Nurses USA, and it is adopted in India in 2010 by Indian Society of Trauma and Acute Care under the ATLS India. Duration of the course is 2.5 days, and participants, we can take 16 to 20 participants in a course. There will be one course director, one course coordinator, and at least there is a minimum requirement is 4 instructors for the course. And there is need for 4 patient live models. They are not actual patients, they will be simulated patients. For ATLS provider course, participant must have to receive the ATLS and ATCN manuals. They have to read the manual before attending the course, and they have to fill that pre-test after reading the manuals before attending the course. And the course contains the interactive lectures, group discussions. There will be live demonstrations on the simulated scenarios, and there will be hands-on skill stations. And there will be finally assessment on the simulated patient scenario, and they have to clear the final test, written exam. As soon as participants register to us, we provide them the ATLS and ATCN manual. They have to read those manuals thoroughly before attending the course, and we ensure that participants must have to receive the manual at least 6 weeks in advance. They have to, after reading those manuals, they have to fill that pre-test which contains 40 MCQ questions, and they have to submit at the time of registration on the day when course starts. In course, we are having the interactive lectures, and there will be demonstrations, live demonstrations will be there in the course, and we are having group discussion on the triage during the course. There are practical life-saving skills. We are having 6 life-saving skills stations during the course, that is on initial assessment and management of the trauma victims, airway management, management of hemorrhagic shock, management of pediatric trauma patients, as well management of head injury patients, and management of musculoskeletal and spine injuries. And finally, participant will be practiced on the simulated patients. Injury will be marked on the live models according to the scenario, and they will practice on those live models, and finally they will be assessed on those live models patients. And on the day 3 they have to clear that post test, which again consists of 40 MCQ questions, and they have to secure 80% marks in that post test for successful completion. The certificate is valid for 4 years, and after expiry they have to do the recertification course, that is 1-day refresher course, and because that every 4 years they will update based on the research evidence basis, they will update on the manuals, so they have to do the refresher course after 4 years. In our All India Institute of Medical Sciences, ATCN course was started in March 2010. A team of faculty instructors came from UAE, US and Germany, they started the program in India in 2010. If you will see the status of our ATCN program in India, we are running regularly at JP Trauma Center, AIIMS, New Delhi, and also we are running in Kerala. Till now we have completed 33 ATCN provider courses, and we have trained 472 nurses in the course, and presently we are having 2 ATCN course directors, 18 ATCN instructors in India, and soon our ATCN provider course will be available at all ATLS approved sites. That will be in Ahmedabad, Pune, Mumbai, Chennai and Jimmer, Pondicherry. And soon sites are coming in KDM Lucknow and Goa also coming year. ATCN India program also supported Indonesia to promulgate the ATCN program. 2 of our instructors were invited in 2012 to start the promulgate the program in Indonesia, and we done their provider, instructor and provider back-to-back 3 courses in 2012, and then program is running now also in Indonesia continuously. So ATLS and ATCN course provide standardized information and skills for trauma patient treatment. After implementation of ATLS and ATCN methodic in India, it built basement for creation and development of trauma care system in India. Thank you. Yeah, course fee is 10,000 rupees for the course, which include the manuals, ATLS and ATCN manuals. That manuals has to come from US, so we have to pay for those manuals and the consumables which will be used in the course. Yeah, please.
I missed it. Did you say this has the same authority as the ATLS? Is it conducted from the American College of Surgeons?
Yes, please. Yes.
No, the ATCN is a course of the Society for Trauma
First
Medicine, USA, but they work very closely with the ACS. Okay. Okay, so there's consistency.
So yes, yes.
Yeah.
So similarly, along with ATLS, we are running the ATLS. Thank you.
So thank you, Rajesh.
I just wanted to clarify Professor Ravi, you can onboard online. You can onboard if a hospital wants to join the ORS portal, you can onboard online. Just go to ORS patient portal and you can join.
Thank you.
Next we have Ms. Sonia Chauhan. She is trauma nurse coordinator at JPN AIIMS Trauma Center. She is also ATLS coordinator and ATCN faculty and also PhDSL faculty. She also got AIIMS of America Award for the best nurse in research for 2010. Ms. Sonia Chauhan.
Okay, thank you ma'am for such a warm welcome. Good afternoon everybody. I am highly delighted to present this new paradigm of trauma nursing, which is trauma nurse coordinator system. Actually, this is a new concept in India. The objective of my presentations will be, I will tell briefly about the background, how we started with trauma nurse coordinator system in India, and also what is the administrative structure, reporting system of trauma nurse coordinators, who should be a trauma nurse coordinator and the quality improvement interventions, and also about the challenges faced by trauma nurse coordinators. JPN Apex Trauma Center was started in 2006, and a delegation of 20 healthcare providers, including 6 nurses, was sent to Rambam Healthcare Campus, Israel, because they have got very good trauma system. So we went there and learned trauma system and mass casualty management. And from there, we learned the concept of trauma nurse coordinator. And in India, the first trauma nurse coordinator system was started at JPN Apex Trauma Center in February 2009. Now, as Professor Mishra covered yesterday, that the trauma care involves resuscitation to rehabilitation. So role of trauma nurse coordinator also lies from resuscitation to rehabilitation. Trauma is a surgical disease. The leadership role goes to the trauma surgeon generally, but there is need of a person who can coordinate the care of the patient who is injured from the time of arrival into the hospital until the patient is being discharged. Thus, this concept of trauma nurse coordinator was developed. A trauma nurse coordinator is a skillful registered nurse in trauma care nursing. She is accountable for development and implementation of nursing standards, and she is also responsible for development of trauma care protocols, and she continuously monitors the effectiveness of these protocols and standards, and also if she identifies any problem, she initiates the corrective measure. In JPN Apex Trauma Center, the trauma nurse coordinators are the nurses. It is an internal post. They are from the nursing department only, but the reporting system is, you can see that their trauma nurse coordinator are posted in clinical areas. They are having two types of duties, follow-up duty and emergency duty. Apart from that, one trauma nurse coordinator is dedicatedly doing the data management, because trauma nurse coordinators are doing trauma registry also. There is senior trauma nurse coordinator who is basically responsible for the administrative part and making the duty rosters and all. And also he is responsible for ATLS teaching programs. They are reporting to faculty in charge trauma nurse coordinator system, and ultimately the top level manager is Chief JPN Apex Trauma Center. The role of trauma nurse coordinator lies in clinical practices, research, education, administration and community care. I will cover each area one by one. As far as clinical practices are concerned, as I have already mentioned, she is the patient's advocate. She is coordinating the care of trauma patient as soon as the patient is coming into the hospital until the patient is being discharged. If some channel is missing somewhere, trauma nurse coordinators come and she plays her role and she tries to fill that gap. And she is having two types of duty. One is emergency duties. That means round the clock in the emergency department, one trauma nurse coordinator is posted. She is continuously coordinating the care of the patients who are coming in the emergency. Along with that, the patients, some patients are getting discharged from the emergency itself. But for the patient who are admitted in the hospital, there are the trauma nurse coordinator will be having follow-up duty. So they are following the patient in the ward. They are just monitoring whether the patient care in the wards is going smoothly or not. If there is some problem somewhere, they play the role and they try to correct that problem. Also, trauma nurse coordinators facilitate the interdepartmental consultations and referral issues. For example, some patient is admitted under trauma surgery, but he simultaneously requires consultation from some other department, say medicine. Then automatically consultation is being sent to that specific department. But sometimes there is due to some problem, if delay in the consultation is there, then trauma nurse coordinator will come in the picture and she will request the concerned department and ask them to see the patient. She is also responsible for she also facilitates the rehabilitation of patients, especially the patient who lose their limbs. So she facilitates the rehabilitation of such patients. The trauma nurse coordinators acts as the patient's counselor. She is communicating to the patient and his relatives. She is listening. She is basically acting as an advocate to the patient. She will listen to them and she will try to solve the problem of that particular patient and relatives. Once the patient is being planned for discharge, she will consult the specific specialty, and she will make sure whether the patient is ready for the discharge or not. And also she makes sure that discharge advice, because once the patient is out of the hospital, the patient should not suffer. He should get proper care. So for that, she makes sure the discharge planning has been communicated to the patient and relative in a specific way, in a proper way. And also, trauma nurse coordinator has got liaison with pre-hospital care providers. For example, for cats, which is a main pre-hospital care provider in Delhi. Before bringing the patient, they are communicating to the trauma nurse coordinator in some of the cases that yes, we are bringing so and so patient, so that she is making everybody aware in the emergency that we are getting one patient from there, and likewise she will make arrangement to receive that patient. Without team, nothing is possible. So we believe that the team philosophy, we as trauma nurse coordinator demonstrate mutual respect in all communication, and also we are strong supporter of team approach. This is one example of protocol development. This is red area protocol in our emergency department. In this we have got defined role and defined positions around the bed of the patient. In trauma, we are following red area protocol, that is code red, ATLS, and if the patient is, sometimes patients are coming with cardiac arrest and so, then we are following code blue protocol. Here you can see there all team members are there. The role of trauma nurse coordinator is to make sure once the patient is in, this protocol is being followed properly or not. Okay, if somebody is missing, she will just pull that person and to act in the proper way. This is just the floor plan of the previous slide only. This is how the footprints are there. So the color coding, for example, this purple coding is for emergency nurse. So she will make sure that everybody is there in the team once the resuscitation of the patient is going on. Also, trauma nurse coordinator has got license with the social support services, that is medical social services officer for poor and homeless patients. She facilitates rehabilitation of the patient, and also she monitors the home care. Once the patients are being discharged, when they are coming for follow-up, then she makes sure that at home patient is being taken care of properly or not. As far as education is concerned, trauma nurse coordinator has got role in coordination of academic programs like ATLS, ATCN, PHTL, pre-hospital trauma life support. She helps the policy makers in making new protocols, and also making protocol is not enough. You'll have to communicate it to the hospital staff who will really follow it. So she spread the awareness about these new protocols. She also makes sure that there is no breach in the protocol, and if some problem is identified, she initiates the corrective measures for those particular problems. In education, we are trauma nurse coordinators are key person in the dissemination of teaching programs. For example, ATLS, ATCN, PHTLS, RTTDC. Also, these were the programs from US or some other country. Now, in AIIMS, we have got new creation of new programs as well. The trauma nurse coordinator is a key person in creation of new programs. For example, this is management of acute wounds in emergency, AIIMS trauma assessment and management course, AIIMS critical care course, chemical radiological explosive advanced training in emergency. So trauma nurse coordinator is a key person in creation, and as well as she is acting as an instructor and coordinator for these programs. Very important role of trauma nurse coordinator is there in research. Trauma nurse coordinators are doing data collection. They are doing trauma registry. You can see this trauma registry form. This is the first page of this trauma registry form. It has got 6 pages, and in this you can see that patient's demographic details, mechanism of injury, and pre-hospital details, and what happened in the emergency department, initial vitals, and after the patient is being admitted, what all sequence going on. So that all is mentioned in this trauma registry. It is a brief of a patient, and this is hard copy. And during the follow-up duties, trauma nurse coordinator fill the whole detail in trauma registry software. And once they are entering it in the software, Excel can be retrieved, and which is helpful for for others also for research purpose. Trauma nurse coordinators are teaching the community people. For example, in this picture you can see volunteers from villages. They were taught by one of the trauma nurse. The trauma nurse coordinator is teaching them about the basic management, emergency management of trauma victims, so that because they are the villagers, they are the first responder at the time of injury. So they are doing community care in this way, and also we are teaching police personnel and community people also. Trauma nurse coordinator plays very important role in quality improvement by organization of preventable death panel and patient safety meeting. In this, we identify some of the cases which were in the mortality was preventable. So in big forum, it is being discussed what went wrong, and in a constructive way, the remediation of the concerned person is done, and also so that these mistakes may not be repeated. Trauma nurse coordinator is also responsible for implementation of protocols and standards. She monitors the effectiveness of trauma program, and also she initiates corrective measures by a very important method, which is incident reporting. This is escalation cycle of trauma incident reporting. In this, you can see the trauma nurse coordinator, if some unusual incident happens, which leads to loss of property or loss of organization in any sense, then it is being reported by the trauma nurse coordinator to the faculty in charge trauma nurse coordinator system, and faculty in charge will communicate to the additional medical superintendent or the concerned specialty, and also the information is sent to the chief JP and Apex Trauma Center, and after that during the patient safety meetings, the solution is devised and policies and protocols are made, and in this way closure of loop is there. This is there are some example violence incidences happened in the past, so that was some actions were taken, security was increased. This is another example where there was delay by the senior resident, then incident were reported by the trauma nurse coordinators, and interventions were taken. Now this was what we told about you in the routine. Trauma nurse coordinator has also got very important role in disaster management. When the resources are less but the burden is more, so then also the role of trauma nurse coordinator is very important. We have got hospital contingency plan for mass casualty incidents at our center. Here you can see that role of trauma nurse coordinator is this. It is very important, and as soon as the information is being received, she has got very important role in communicating to all the staff, and she has got very important role to play during the mass casualties as well. We as trauma nurse coordinator believe in self-discipline, so we have got self-regulated standard. TNC surveillance meeting is there, monthly meeting is there. In this, we are discussing about the whole month's data, whole month's patients incoming, and if there is any preventable death within the TNC group. We are also having informal discussion of important cases within the TNC group. We have made WhatsApp group also because it is now very much popular nowadays. So we discuss about informal important cases and important information. Data manager checks the data entered by TNCs regularly. We have got mortality and morbidity review. And also we as trauma nurse coordinator have regularly get positive critiquing by our faculty in charge. As trauma nurse coordinators, we are facing some of the challenges. For example, violence incidences. When violence incident is there, everybody in the emergency, most of the time it is there in the emergency, everybody will expect the trauma nurse coordinator to settle the things before the senior people come. So there are chances that she may be hurted, but still she will have to act and she will have to play her role. Uninformed referrals, sometimes these are with or without life support equipment. Everybody wants to be treated at Apex Trauma Center, AIIMS, because it is government hospital and it has got all the facilities. So at that time, sometimes you are in a condition to take the patient, but if you are not in that condition to take the patient, then it is very difficult to convince the patient's relatives and the people who are accompanying the patient. There sometimes emergency care is being given to all the patients who are coming to trauma center, but if we are not in a condition to admit